Yeah, well, thank you, Jennifer. This is Art Viewing Adventures. I'm Rodney Paul, joining with my friend Charlie Goldberg. Charlie and I have been guides at a local museum known for having newer art, which we affectionately call the San Francisco Unnamed Museum of Art, SF UMA, because they're a little shy about being named. But Charlie, you've been very interested in art that talks about or shows us depictions of medical science, because you yourself were a physician for many years. And thanks for coming on Art Viewing Adventures. I'm looking forward to seeing these artworks you're going to be sharing with us.
Great, thanks, Rodney. So what I call this talk painting the stethoscope, and basically what it shows is how doctors, nurses, patients, and diseases are portrayed in art. I don't think we'll have a lot of time to show a lot of the diseases because this was originally a 2-hour talk, but we'll go ahead and continue. So, my early part of my life was here at Kaiser Oakland. I was an emergency room doctor. But if you looked at my office, you could see that my office was filled with postcards of art, of course, Paris as well. But, I had the entire wall filled with postcards of art, which I used to really, really love. But the sort of inspiration for this talk was when I saw this particular painting, which I thought was so interesting in a lot of ways. And before I talk about it, I want you to think about who might have been the artist for this painting. And if you can guess who the artist was, I'll buy you a coffee at a coffee shop of your choice. Um, because it's really fascinating. In a million years, I certainly wouldn't have known that this painter had done this. Does anyone have any guesses as to who?
I saw a guess of Munch, which is kind of close, especially because of the person in the bed. But it actually, I know who it is. So,
Yeah,
other thoughts out there?
I think it looks like a Manet.
Manet.
that's a really, really good guess, Vivian. It does kind of look like a Manet, but it's not. So I will tell you this: this was a very, very important artist in the 20th century.
Art.
As
Yeah,
in
also very well known. So you will have
very
heard of
well
him.
known.
Oh, it's a white male artist. That's his name.
Yes, I will go so far as to say probably the most important artist in the 20th century. So without any further guesses, I'll tell you who it is. It's actually Pablo Picasso. And it's a painting that he did right before the turn of the century called Science and Charity. And I was just really fascinated by this painting because, we're looking at 1897. And what he does, on the one hand, he shows the sciences, right? Here's this doctor, he's taking the pulse, he's doing this very scientific approach to the patient. And what you have on the other side is this nun who's holding this person's child and offering presumably a cup of tea, some sort of hot beverage. And, in 1897, it was sort of a crapshoot. Which was more likely to heal you, science or faith? And so it really got me thinking about this. And of course, this painting is based on an experience that Picasso himself had. He lost his younger sister when he was a young boy to diphtheria. And so the idea of having someone in a bed sick was an important image in his mind. But he did this at 15, if you can conceive of that. It's just a remarkable painting for someone of that age. His father was a painting teacher. He worked at the Academy of Art, and his father looked at this and, he's like, I'm done here. I've got nothing to teach this kid. He was just incredible. And he won a major award. So that was the first thing that really got me thinking about coming up with images about medicine in art. The other thing that really intrigued me is that St. Luke, and of course, everyone knows a St. Luke hospital. St. Luke is the patron saint of both artists and doctors, which I thought was really fascinating. I had not known that he was the patron saint of artists. So I really liked that connection as well. And then, for those of you who know me and can see, I've actually recently been a patient. And So this talk really means more to me now than the first time that I presented it, because I have a different perspective on the artwork that we're looking at. So the first thing I want to start with is how hospitals were depicted. And this is an Alzheimer painting that was done in the end of the 16th century. And of course, when you look at this painting, what you see are wards, one bed after another. And if you know any infectious disease doctors, they're probably spinning in their heads trying to figure out how could you have all these sick patients in a single room like this. But this was the way things were. And probably, I can't say for sure, but probably there are still some hospitals in the United States that still have this ward system, but I don't think there's many of them. I mean, it's just not very healthy. But I thought it's kind of an interesting image to show. But the next painting shows another view of a hospital, which I found really interesting in a lot of different aspects. It's by Di Bartolo. It's called Care of the Sick in the Pellegrinaio, or the Pilgrim's Hall. And what's interesting about this painting is that in the center of the painting, the patrons of the hospital are being shown the hospital. They're being given a tour of the hospital, but there's all kinds of madness that's going on in this hall. You can see, here's a cat and dog that are fighting. Here's a monk who's giving last rites to this patient here. You see someone being carried in on a stretcher there. But it's in particular in the lower left that I'm really fascinated with what's going on. And what you see here is you see the two physicians, and when they're holding up a urine sample. And so they're having this very clinical, scientific discussion about the urine. Whereas here is someone who's not one of the doctors, who's really very gently putting down this patient into the bed and really showing the kind of care that most of us would like to have, instead of having just someone very clinically talking about whatever we had going on. And then we have this image here. And what's happening is this man has a bad leg wound here. I don't know if you can all see that. But, this person is being prepared for surgery. But, it should sort of remind us of the story of Christ cleaning the feet of beggars. And I think that's what the painter is trying to do, especially since it's actually this leg that's going to be operated on, but you see the left foot being washed by this person at the hospital. So I thought it was a very moving work. Let me just go back so you see where all that is going on. And, it's a really beautiful hall that's being depicted here. And so there's a lot to take in this particular painting. And then there's this one by Geoffroy, which is called Visiting Day in the Hospital. This takes place in France, and it was very common that there would be only one visiting day that you could see your child in the week. And so here we have this, kind of a little bit disheveled. His shoes are a little dirty. His coat has probably seen better days. So it's his one day of not working that he goes to see his son. And you can see he's brought his son some oranges, which are off to the side there. And it's just, you can see again this ward system. But one of the things that I think is really interesting, and what I love about this painting, is what's going on here. I think it's really wonderful that you see this brother kissing his brother in the hospital. It makes it a very, very tender moment in this painting, which is one of the reasons I really like it and continue to like it.
Also, so I like the composition of that painting too.
Yeah, it's really great. Here's the father in the foreground wearing very dark clothes, and almost everything in the background is a lighter shade, and it really brings a lot of contrast. So on the one hand, we're concentrating on the father and then the relationship between the father and the son. But I love how there's other things that are going on in this painting that just give you a sense of what it was like to be in one of these wards. And there's lots of stories of kids being hospitalized that really love their time in the wards. They got to meet other kids while they were sick. Of course, this kid's not looking all that great. He's pretty pale and doesn't look all that active, but let's hope that he gets better.
Gail points out that the window is in the shape of a cross in the back.
Yes, yeah. So, there's a lot of connection between healing and religion. And we'll see that in some of the other images I'm gonna be showing you. But here's another depiction of one of these wards, and this is by our friend Van Gogh. And I just love this idea that it had to have been kind of chilly on this day because they're all wearing coats, they're all huddled around this really great stove that he depicts there. And then, as was it? I'm sorry, who was it that just mentioned that?
Oh, Gail.
Yeah. So again, we see, who are the nurses here? They're nuns, who are taking care of the patient. We see a cross in the back. So, a lot of, St. Luke, right? Patron saint of doctors, and then by extension, hospitals. But, one of the things, just speaking from an artistic point, is that Van Gogh takes a lot of liberties with the actual construction of this painting, because these beds don't really make sense, right? If you were a patient in these beds, you'd be basically falling right off of them. But, he plays with the angles and the perspective and changes that, which I find to be a really charming part of this painting. I also really like how you see the light that's being reflected on this wood floor and the way he renders the wood floor. So that's Van Gogh's depiction of a hospital.
Sarah thinks the greens of that painting are kind of ghastly.
Yeah, they do have a little bit, I mean, you've probably heard people say you're looking a little green today, right? So it's not a healthy green, right? We see green where it's in nature, for example, where you see these vibrant colors. Here, it's a little bit of a sickly green, Sarah. I have to completely agree with you. And then there's Vuillard, and I love this particular painting for a lot of reasons. Vuillard was one of what was a group called the Nobbies that were sort of post-impressionist, that were sort of trying to create their own vision. The Nobby means prophet in Hebrew, and so their idea was that they're the prophets of what art should be in the future. And there's just a couple of aspects of this painting that I think are so wonderful and worth talking about. So for one thing, I love the way the main doctor, this associate doctor, and the nurse, all their eyes are on the patient. So the patient is really the focus of what Vuillard is doing here. This doctor here is taking notes while the head doctor is talking. But there's one thing in particular that I love about this painting, and that's this. I had a teacher when I was in medical school who said to me that there are two types of people with which people are happy and expecting to be touched by. And one is by their religious leader, be it a priest, a rabbi, an imam, something like that. They expect to be touched by that. But the other one is a doctor. That's part of what they expect from their care. And I really took that to heart. And I really tried to make a point whenever I could to lay on the hands to show that there was a connection between myself and the patient. And so that comment was really important to me. And I think here Vuillard is showing that in a really lovely way. The other thing that he does, I don't know if you notice this, but there's a figure outside. And I just love the fact that, here you are, you're a patient in the hospital, but life still goes on in the background. There's people going about their business. And I think it's a lovely painting from that perspective.
Comment from Lucretia: the laying on of hands for healing is mentioned in the Bible.
Yes, it is. But I love that my teacher had taught me that, you're a doctor, it's okay, even expected, to do that laying on of hands. And, again, having been a patient recently, I've had good doctors who did this and just okay doctors who didn't, and it's not like, especially I think in these days of COVID and things like that, there may be less of that in hospitals now than you might have seen in the past. But I think it's just it was a really important part of my training, and it meant a lot to me to hear that. All right, moving on. Then this is an artist from Italy named Giancarlo Vitali, who himself was hospitalized. And while he was hospitalized, he did a bunch of sketches of other people and himself in the hospital. And this is one called the intubated patient. And if you're not familiar with that term, what that means is this person was unable to breathe and had to have a tube put down into their throat. And then they're attached to a breathing machine. So what's interesting to me about this particular work is that, yes, you see the intubated patient and you see that tube coming out of the mouth, but what you don't see is all the other machines that are associated with being in an intensive care unit, which someone who's been intubated would be. And it also, you have this sense, with these sheets sort of falling down as though this person were being lifted up into heaven. That's at least my reading of this particular work, that it really feels like this person's having their last moments on earth. And I found it very, very moving. And I wanted to show you another work by Vitali because I thought his experience as both patient and artist were really fascinating. And this one, it's called And So, right? And I was in this position where someone, where I'd be using a urinal and, someone would walk in on me while I was using the urinal and, your butt is hanging out, your hospital gown's almost always too short. And, you have this loss of dignity as a patient, which, to me, it didn't bother me that much. I'm just not that vain that it bothered me. But I was amazed at how easily nurses or doctors would just walk in without knocking or something like that. And I think he captures that really well. And I think the other thing to notice is, what is he doing this work on? This is a torn out sheet from calendar. Does everyone see that? And here's all the days of the week and, the times, for your appointment. So he's taken out an appointment book, and that's what he's using to do a rough sketch of this patient who's peeing into a urinal. So it's a nice other aspect of being in the hospital. All right, so now we're going to get to some depictions of doctors, dentists, and nurses. And I'm sure most of you have this book, Hospital Doctor, which is a revealing novel of nurses, doctors, strange operations. And I just, love this pulp painting that's on the front, and then this nurse who walks in and into the call room while this is going on. And, there's this look of, is this a love triangle perhaps, or is she just absolutely disgusted by what's going on? It's just a great work. So, I don't want to reveal the ending of the story for you. I'm sure most of you will read it alone. But, then we have Asclepius, who is the Greek god of healing. And, of course, this symbol of medicine comes from Asclepius, who's walking with a caduceus, which is this snake that's crawling up. And the snake was seen as a healing symbol because, what can snakes do? They can lose their skin and regenerate. And so in ancient times, the god of healing was associated with that ability. And what's also interesting is that venom has actually been used in some medical applications as well. So have you seen this, Rodney, this particular, this
So I've seen the
Asclepius?
symbol. I never understood why there were snakes. So
Yeah.
It's kind of interesting to contemplate like where that came from.
Right. And oddly enough, these snakes around a pole also are a sign of commerce. So I don't know why snakes would be associated with
Well,
commerce.
that makes more sense to me. That does, a lot of business seems like there's a lot of venom being.
Well, healing used to take place in the marketplace.
Sure. Yeah. That's a good way to think of it.
Sarah says snakes for good rather than evil.
That's right.
And Lucretia
Isn't
says,
that, I think that's the Google motto, isn't it? So
Lucretia says there's a story in the Bible about people having to look at a snake to be healed.
yeah, I'm not sure I would really use that as a healing method. I would at this point go for a more traditional method of healing instead of staring at snakes. Yeah, that could go bad in a number of ways. And here's an image that was found from a Pompeii fresco. So we're talking 150 BCE, perhaps. They don't know the exact date that this particular work was done, but it's Iapix as a doctor or as a healer who's removing an arrow from the thigh of Aeneas. And, Aeneas's role in mythology is really pretty wide. I mean, we read about him in the Iliad, but you see him in a lot of different stories, different mythological stories. And he's been near death many, many times. And he's been saved by the gods. His mother was Aphrodite, who we see here. And she has saved him many times. And actually, Zeus comes in and saves him also. And eventually he becomes a god, so he becomes immortal. But, you see the scene with his son crying because, this type of wound, again, we don't have antibiotics 150 BCE. So this kind of wound could just as easily have killed you as not. So this could have been a mortal wound. And so it's it's kind of an interesting work. And I wanted to just show this particular work because it's not known who did this work, but it shows a woman doctor. And this is in the 1st century. And it's really the only known Gallic representation of a female physician. So I thought it was kind of interesting from that perspective. But I wanted to show another one, which dates back to the earlier comment, which is another woman acting as a healer / nun, and how, this is in the 12th century, and nuns were often the ones who were healers. A lot of them were herbalists. PBS had a show with a monk that was an herbalist that would, I can't remember the name, with Jacoby. Someone in the group will know what I'm talking about. But, we see this nun / healer who's mixing up, who knows, some sort of potion or perhaps something to apply to the skin. And then these are the two classic physicians, Galen and Hippocrates. And many of you may have heard of the Hippocratic Oath. So this is a depiction that's a very positive depiction of these two great healers. And, you see them, they have this very intellectual look. You can see they're discussing. And, here's Hippocrates' quote, which is that a doctor who is a lover of wisdom is the equal of the gods. And so it's promoting this idea that knowledge above all is the most important thing in being a good doctor, that you have to study, you have to look at the old books and figure out how to heal people. Now, nurses almost always fare pretty well. Not always, but almost always. And here, this idea that taking care of others is a gesture of mercy. And we have this nurse who's taking care of this ill man here. Again, this is the 17th century, but I love this interaction of the patient and this child. And this could be either a boy or a girl. At that time, it's just as likely that boys were dressed in dresses as girls. But it just shows this really tender moment between this, sick patient and their family member, and this nurse who's applying some sort of compress to the head of the patient. So I thought this was a really interesting work as well. Rodney, feel free to interrupt me if you have any comments about any of the works that we're talking about too.
No, we are getting a lot of nice comments in chat from people who are enjoying this. Gail just said she was fascinated to learn about why the snakes were the model or were the
Right.
medicine. So yeah, no, this is great, Charlie.
Oh, thanks. So then, of course, the nurse of all nurses was Florence Nightingale, who really revolutionized how nurses worked. And she was most known during the Crimean War, which was in the 19th century. It was really the first time that you saw nurses being utilized on the battlefield. And supposedly she reduced the wound mortality from 50% to 1%. I'm sorry, that just doesn't pass the sniff test for me. I don't believe it, because you still don't have antibiotics at that point. And I'm sure she reduced the wound mortality, but from 50% to 1%, almost nothing works that well. So, but what we're seeing is this is Florence Nightingale right in the center. And what Barrett has done in this painting is that, you see, what she's wearing is kind of like a bonnet, but it has almost a halo-like appearance. And that's very deliberate. He's really trying to put her on a higher pedestal. And she really did wonderful work. I mean, there's no question that she revolutionized nursing. And many of her methods have been, continued on into the 21st century. So it's an interesting, and then of course you can see, I love this idea that you have this line of patients that are coming in to see her. Crimean War, they wore red suits, always a good idea on a battlefield to wear red. And then the thing I really like is here's Barrett putting himself in the painting. He's overlooking what's going on in this makeshift hospital for the war. And then we have the more hilarious views of doctors. So here is Van Hemessen's painting of the surgeon, and he's extracting the stone of madness. It was thought in the 16th century that that's what madness was caused by, that you had a stone in your brain that was causing you to be off in some way. And you can see there's sort of a line of people that are waiting to be healed from him. And here's this nurse that's helping out, no anesthesia, maybe some wine beforehand, but he's cutting right into his forehead. And folks, let me just tell you that there's not a stone like this in your foreheads. I don't care how crazy you think you are, it just doesn't exist. So it's a pretty hilarious painting. And of course, what he does is he shows these papers on the side, which are probably counterfeit surgical licenses, because this guy's a quack, is what he is. And, he would have been carrying these papers and probably was an itinerant surgeon, which meant he would go from town to town. What I like about this particular painting is that he really shows us what's going on in the particular village. We see what's undoubtedly a church in the background, and you can see some of the people along the street. So I find this to be a really interesting painting. And then we have one of my favorite Dutch painters, Jan Steen, who did a whole number of paintings about doctors. And they're almost never good. So one of the things is this doctor that we see in the center here is extremely well dressed. And so one of the things that Steen does is, that these are sort of foppish at the time men who would go about, and you can see how he's taking the pulse of this woman, but he's actually making eyes with the maid. And he puts in all these symbols, which, of course, in the 21st century, we would have not known about the symbols. The meaning would have been lost to us. But there's a number of things that he does. So for one thing, there are keys hanging down off of this chair. Now, if the lady of the house had the keys, it would mean that she's taking care of hearth and home. It's a sign of faithfulness and whatnot. If the maid is associated with the keys, that means she's opening the doors for suitors. But he has all these other little hints in here. So for example, this little guy down here, what's he playing with? A bow and arrow, right? Cupid. And the other thing is that there's the husband back there just reading, looking bored. So what this woman who called the doctor for, what her real disease is, lovesickness. And this was a common theme that, that women just, it was really, they needed loving more than anything else than the doctor. So it's really interesting. And I have another one by Steen, again, the lovesick maiden. And again, he puts in all these clues for us. Again, we have a really well-dressed doctor tending to her. And there's a number of symbols that we no longer understand. So for one thing, up in the corner here, there's Cupid. So he's telling us that this is a story of love, that's what's going on here. The other thing to notice is right here, her foot is on a brazier, and braziers were such important symbols. If you ever look at the Milkmaid by Vermeer, there's a brazier in the corner. But the placement of the brazier was very, very important. So if a woman's dress completely covered the brazier, she was keeping all that sexual heat within, so she was being faithful. If the brazier was left exposed, it meant that this woman is open for action. And you can see that he has these other braziers coming in. This is a bed warmer here. This is another brazier here. So he's trying to give us as many hints about that. But, you know, if you're not getting those hints, what you see in the corner is dogs copulating. And I'm sorry that I couldn't get a better blow up of this, because it's in the back. I'll go back to, so it's these
Well, this is
dogs.
a PG show, Charlie.
Yes,
So
yes, exactly. So that's why it's being fuzzed out for your protection. So, you know, that's what Stain often thought about doctors, is that they were quacks, and more interested in the maids than in the patient.
Gail noted a clock symbolizing the passage of time, maybe in the previous, right? Is there a clock in this one? Yeah, that clock there, maybe
Yes.
symbolizing the passage of time and the death as a chime.
Yeah, we'll get to that in just a moment. I have better examples of that a little further down in the presentation. But absolutely, that's a great pickup to see that. By the way, this is also an erotic scene that's going on in this painting. It's very hard to make out because it's very, very dark. But I wanted to go to this next, because I haven't shown you dentists yet. And I just love this painting. You know, this was very, very common, where you would have operations as theater. So that what you see here, and I don't know how well this comes out, but there's all these people in the background who are watching what this dentist is doing with wonderment. And I don't know if you can see that there's a hand that's holding this patient's hand. And, you know, you can see, you know, there wasn't the kind of anesthesia that there is now. But what I love about this painting is the use of chiaroscuro. And chiaroscuro is this, it really started with the Italian Renaissance. It's this idea of showing the difference between what's light and what's dark. And you have a very defining moment between the two. So here we have the helper. And you can see, here's his hand, and on the other side of his hand, he's got a candle. He's trying to cup the hand so that the dentist gets as much light as possible. And you can see the chiaroscuro over the helper's face. It's a really, really wonderful painting from a painterly point of view, because he really captures it well. And it's, you know, oh, help me out here, Rodney. I'm having a senior moment. The great Renaissance painter, one of my top 10 painters, Caravaggio. You know, Caravaggio was really the one who really exploded the idea of chiaroscuro. And if you get a chance to go to Italy, there's a great Caravaggio exhibit going on in, I think, Rome right now. So, you know, here's one view of the dentist looking, you know, again, this idea of theater is really important. I'll show you some other examples of that in just.
Did you have to pay all these people that would be in there?
No, not in this, but no, we'll get to that in just a minute. But no, these people would not have been paid. They're just hangers on. They're lookers on. Yeah. And then here's John Collier, who does the dentist. And of course, I love the fact that the patient is being asked to support the leg of the dentist here. And you know, this is sort of a take on the, you know, hanging a string to a doorknob and, you know, slamming the door, except here you're paying this dentist to come in and do here. And you can see this is sort of a caricatured view of what a dentist's work would have been. Again, you know, we're talking late 18th century, not a lot of anesthesia available aside from the bottle of wine. So it, you know, but it's still a funny look. And Collier did a lot of paintings of doctors, dentists, nurses, things like that. But I wanted to show, I'll get to something later. But this is the birth of Julius Caesar, from where we get the name Caesarean section. If you look, right, here's the doctor who is literally cutting Caesar's mother's belly open. I'm not seeing any anesthesia going on here. Do you notice that, right? And what's interesting is that there was sort of this rule against giving mothers of future rulers any sort of anesthesia. because it was thought that it was childbirth was to be endured and embraced, and that pain is what was going to make this ruler even stronger. And so this poor woman, a cesarean section without anesthesia, unthinkable for us in the 21st century. But this was common practice at that time. And the idea of giving anesthetics to royals didn't really come until really mid-19th century. And this is Queen Victoria, who became the first royal to get anesthesia. And you can see how many children she has in front of her. Well, she had all of these children without anesthesia. I think it was with her 6th child or 7th child that they finally gave anesthesia. And of course, anyone who's been a mom is going, how could they not give it on the first child, which is the most difficult child? By the time you have 6 or 7 of them, they pop out fairly easily, But so it was really this horrible practice of withholding anesthesia in the old days. So we're past that. So that's a good thing. Then we get to the 18th century, where we start to see doctors being shown in very, very positive light. And here, again, we see someone that's very well dressed. This is Dr. Richard Mead. We don't know who the artist is, but this was part of the show of being a doctor, is that you had to really attract a wealthier clientele by showing yourself as a really fine fitted doctor. And what he's doing here, he's pointing to a treatise that he himself wrote about snake bites. Again, this is another sidetrack about snakes and doctors, but he came up with the idea that snake venom is only deadly if it enters your bloodstream, but that you could drink snake venom without any sort of bad outcome. Now, luckily, he didn't have ulcers while he tried that, but nevertheless, that's him. And again, we see the books, the idea of being learned. And this guy was pretty wild. He actually got into a duel with another patient with another doctor about the treatment of smallpox. So things were pretty wild and woolly in those days. And here's another very positive image of a doctor. This is Edward Jenner.
We have a question from
Yes.
Lucretia.
Yes.
Who is in that mirror? Who's?
Oh, that's Athena in the background. Athena.
But there's a mirror that's being held. Is that right?
Oh, yeah. This is a shield. And I can't quite remember who that is in the shield. So I apologize for not knowing that. But yeah, Athena is overlooking, again, this idea of the doctors are watching, are being watched by the gods in a positive way. Yeah. And so this is Edward Jenner, who came up with the smallpox vaccine. And here he's kind of shown as a country gentleman. He did have an estate in the country. And of course, because he came up with the smallpox vaccine, which comes from cowpox, that's what's being shown in the background here. And what's so great is at the time, it's wonderful how things change, but they don't change. People were so skeptical about the idea of having the smallpox coming from cows that we have James Gilray, who does this, caricature of Jenner giving the smallpox vaccine. And what happens if you see every single person has a bit of cow growing out of them. Here's a person with a bit of cow coming out. This person, you can see the horns coming out of his nose. This person has cow coming out of that, so yeah, things change, but they don't change. You have the same sort of distrust of vaccines.
Robert Kennedy Jr. into this painting, perhaps.
Yeah, I think that's him right here.
Yes.
If you look carefully. And Gilray did a lot of, like Jenner, did a lot of, not Jenner, I can't remember now, but he did a lot of paintings of doctors, nurses, many of them caricatures. But I love this particular one that he does of a disease. And I'm going to just put it out there. Does anyone know what disease he's trying to show? If you had this disease, you know immediately. But any thoughts on what this might be?
I'm not going to chime in because I know the answer. I'd love to throw it. Oh, I see.
gout?
Gout. Yes, it's gout.
Gout. Yes, indeed. Gout, because the classic sign of gout is pain that you get in this portion of the big toe, the junction between the toe and the foot. You know, if anyone's had gout, you know, there's so many wonderful descriptions of the pain of gout, but I think this is a great visual description of this kind of diabolic animal biting into your toe right at that point. So Gilray did a lot of really great sketches. I have more, but I don't have time to really show them all. And then we have this really interesting thing that goes on in the 19th century where you have this, I don't want to say war, but this conflict between doctors and pharmacists. And, you know, at that time, they would have been called apothecaries. You know, this is the title of this particular work. It's called Oliver Goldsmith's Medical Advice Rejected by His Patient in Favor of the Advice of the Apothecary. And so here again, we have this very, very well-dressed, foppish doctor being sent out the door with presumably his wife, perhaps a nurse, I'm not sure. Here's the apothecary who's more humbly dressed, and the patient is really relying more on him than on the doctor here. And then we have the flip side of that here with Thomas Rowlandson, who also did a lot of sketches of doctors and diseases. And I'm going to read you the title because it tells you everything. Death as an apothecary's assistant, making up medicines with a mortar and pestle. That's what we're seeing here. Mortar and pestle, those things that grind medicine. For the apothecary attending a female patient who sits by the fireside. And, you know, this tells you all you need to know where Rowlandson stood on that debate between doctors and pharmacists, you know, because you have literally death who's helping make up the medicine. And here you have the poor patient looking very forlorn because she doesn't know really what she's going to be getting in this particular medicine. And here's another Rowlandson that I wanted to show just because it's got a lot of amusing aspects of it. It's called The Amputation. And we talked about operations and healing as part of theater. And what we have here is these doctors in the background who are all who seem to be more interested in the theater aspect of it, like they're watching something unusual rather than the healing of it. First of all, they're cutting off a leg, which to my reading doesn't look all that bad, right? And I just want you to notice that one leg is being tied down with a chair here. But the other thing that's really interesting to note, and also note the skeleton in the background. So, you know, these are a bunch of quacks that are doing an unnecessary operation. But if you look in the top right, there's this list of qualified doctors, and the names are really hilarious. So you have like, you know, Dr. Peter Putrid, Dr. Christopher Catgut. Catgut is what you would use for your sutures. Dr. Drury Dropsicle. Dropsy was an old term for edema. David Puke and Abraham Abscess. So, you know, he's really making fun of the whole dental medical profession here in this particular work here. Poor patient, again, not getting any anesthesia. And then here we have a much more modern version, almost 20th century version of these ridiculous doctors. And, you know, this is by James Ensor. And some of you may know James Ensor's work. You know, he was a German expressionist. But it's just hilarious to see, first of all, the tools that are being used. We have like a corkscrew here. We have a saw that's over here. You know, so they're using ridiculous instruments. Everything is in complete disarray. We've got the guts of this poor patient that are all over the floor. And here, there's a note that says, woman X died at 7 o'clock, received 1,000 francs to send Z, perhaps for an unpaid bill. Nothing received. I left a sponge in the abdomen. Peritonitis resulted. Peritonitis being an infection of the inner lining. And of course, what do we have in the corner in case you have any doubt what Ensor is thinking about? And as someone mentioned earlier, here's a clock, right? Tempus fugit, right? Time passes. And we'll get into another image that shows that as well. All right, so here's Bizarro, Dan Ferraro, who does a lot of cartoons about doctors, and I just think he's really, really wonderful. And I love this one. I'll have to call you back. I'm with an Erminalte Ace K. So, you know, it's just, he's very, very funny. And I have some more to show you as time goes on. And this is Leonek, who discovered the stethoscope. And what we're seeing in his hand is an early version of the stethoscope. And what he found was he had an obese patient who he couldn't really hear the breath sounds of. So what he ended up doing is he remembered playing this game as a child where he would roll up a stack of newspapers and put it next to things to be able to hear it better. So he used that idea and came up with the earliest stethoscope, which looks nothing like today's stethoscope, but that's what he's holding here in the hand. And I just love these boots that he's wearing on. His coat is thrown on the side. You get the sense like he was called in immediately to go see this patient. And again, nurse as nun or nun as nurse, and these doctors in the background that are watching what's going on. And we have this very famous painting by Rembrandt called The Anatomy Lesson of Dr. Nicholas Tulp. And in Amsterdam at the time, once a year, they would take a condemned patient. This person, they know the name of this particular person. He was hung for thievery. And they would allow a outdoor dissection of this painting so that people could come and watch that. You know, and Rodney mentioned sort of being paid. Everyone in this painting, not the dead guy, of course, but everyone else would have paid Rembrandt to be in this painting. And Dr. Tulp, being the most important figure, would have paid way more than the other doctors who were in this. But, you know, this is, you know, sort of the kind of thing that you'd see on a, you know, on a bus stop now. It's advertising for these doctors who want to get their name out there. And what's interesting is that this particular person wasn't even in on the scene while Rembrandt painted. He got painted in later. He paid sort of after the painting was done to get his face in there. But this painting became very, very influential. And you're going to see a lot of these scenes of the operating theater. And this one by Seligman is such an important painting because what he's done, I'm going to tell you first about this study that was done in 1848 by Semmelweis. And the study was absolutely key in the advance of septic technique in medicine because they found that when midwives came in and delivered babies, that those babies did much, much better than surgeons that would come in to deliver babies. And when I say surgeons, doctors in general. Why? Because the doctor may have been doing an autopsy, may have just been seeing, you know, a really sick patient with an infectious disease, and they didn't wash their hands. So that the midwives would have had cleaner hands to deliver the baby. So here's a painting that's showing this change in medicine. So what you're seeing here is instruments being cleaned for the first time, doctors wearing robes instead of street clothes, which would have carried all kinds of pestilence and who knows what. So it's a really interesting painting. But this idea of the operating theater in art becomes very important. And here we have Thomas Eakins doing the Gross Clinic. And that's gross not as in but gross. This is Dr. Gross that's in the central part of the painting. And he does this painting in 1875. And here you can see this doctor is wearing street clothes. There's no sterile technique that's being done here. But one thing you do see is now we're starting to use anesthesia. If you look at this is the anesthesiologist right here, and they're getting chloroform to this patient. But, you know, I just want you to notice this figure because we're going to compare her to another painting that Eakins does a bit later. And so, you know, again, look at the, you know, just from a compositional standpoint, you have all these people in the back. When I say people, all men. Right? Medical schools would have had no women at this point. All these men looking down at Dr. Gross's operation. And what's really wonderful is here's Eakins himself. He puts himself in there taking notes on what's going on in the operation. And then some 14 years later, he does this particular painting. And I'll put them side by side in just a moment. But this is the Agnew Clinic. This is Dr. Agnew here. And this is actually based on a photo that was taken. And all of a sudden, what's Agnew wearing? He's not wearing street clothes anymore. He's wearing hospital gowns. You know, and so if you compare these two paintings side by side, there's a number of things that are so interesting. So here, no sterile technique. Here, they're wearing gowns, and this little instrument it's a cleaner to sterilize the instruments. And the other thing that I think is so wonderful about this painting is look at the women. In the first painting, the only woman that you see is the mother, wife of the patient. And here she's like shrinking away in horror. All of a sudden, you have this woman who's in the, operating theater. She's standing rigid, very proudly. And this was really the onset of nurses in the operating room. And that's what he's showing, is he's showing the advances in medical science at the time. So I love comparing these two patients. And again, all men were watching what's going on in here. And here's another bizarro. You can put your hands down. Everyone at this party already knows you're a hotshot surgeon. So here's this guy with his hands. This painting is so important, and I really want to spend some time with it because it shows a doctor taking care. The artist himself had a son that died on Christmas morning and had a physician who stayed all night with his son when he was dying from typhoid fever. And this painting becomes so important because they've now modernized printing techniques. This got passed around, and this became sort of the great symbol of what medical care should be. So, there's just these things I want to point out. So one thing that's just great about this, I mentioned that idea of chiaroscuro, where you see this cut between light and dark, and you see this lamp. The lamp shade is being turned so that the doctor can pay attention to what's going on with the patient here. Notice this pose. This is, the pose of the doctor waiting. And what Feldis did is Feldis had an actor stay in this role, and then he painted himself as the doctor looking on what would have been his dead son. But one of the things that's so great is the hands in this painting. They're really wonderful. So here is the sort of anticipatory look of this doctor wondering whether his patient will survive. Here's the hand of the patient not looking so good, just hanging over the edge. And of course, we know the result of what happens. But here in the background, it's a little hard to see. Here is the father right here with the hand on the mother's shoulder as she's crying in her hands. She's got her head in her hands, weeping. I mean, it's just a very, very powerful painting. It became so important that they actually made a postage stamp about it. And of course, the AMA in 1949 used this painting to keep politics out of the picture because they wanted to fight nationalized healthcare. Now we go across the pond to England, and England used the exact same painting to celebrate its national healthcare. So I love how the politics of healthcare is being sort of this painting is being used as a tool for the politics of healthcare. It's really fascinating to me.
Gail's pointing out that the mother's hands are in prayer.
Yeah. Oh, absolutely. Well, her son's not doing well.
There was a question about the earlier image. Do medical students today observe procedures in operating theaters? Does that still happen, Charlie?
They don't in this kind of thing. There are some ORs that have a place where a handful of doctors can watch, but nothing like they did. This is how you learned surgery back then. There were, you just literally watched paintings. Oh, I meant to mention in this prior one, this surgeon right here is Dr. Bill Roth, and Bill Roth procedure is a very important surgical procedure that gets done, and it's named after this particular surgeon. But no, you don't really see operating theaters like this anymore. And then, this is a really hilarious cartoon. On the wall, it says, "Learning makes the doctor see what is not and prevents him from seeing that which everyone knows." And of course, these are members of the Commedia dell'arte, the clown Piero, who's a sick one, the harlequin, and the doctor. Those are repeating characters. And here's the doctor taking his pulse, and basically this woman is telling him, just look under the bed. This is what's wrong with Piero, is he drinks too much. And then here another one. I'm going to actually kind of move a little bit. Oh, well, here I have to show this one. So this is Tamara de Lempicka, some of you may have seen her exhibit at the De Young recently, which is a portrait of Dr. Buccar. And what's fascinating about it is, he's wearing a white robe, which almost looks like a trench coat, which is perfect for him because he was actually doing espionage during World War II, and they used his racing yacht, which all of us doctors have, to transport munitions for the French resistance, and the Nazis found it and destroyed it. And then it was eventually sold to Aristotle Onassis, who refurbished the boat. But, here's this, this great portrait of a doctor. And I just want to point out that, I didn't get the benefit of having Tamara de Lempicka do my portrait. And I'm still bitter at Kaiser for not really hiring a better artist to do my portrait. But there you have it. Norman Rockwell, I'm unfortunately going to have to go quickly through these. Norman Rockwell, so important. I used to do this as a doctor myself. If a child had a doll, you better believe I listened to that doll's chest, and based on what Rockwell did. And he just has these very classic images. But another pictorial essay that comes, a photographic essay that came out in Life magazine in 1948 was Eugene Smith, who was a country doctor. And this was really important for the images of doctors. It shows this doctor on a really stormy night having to see patients in the middle of nowhere. He has these various images of this doctor. And of course, this final image of the doctor sleeping on his own examination table. And then this was so popular that Life actually had Maud Callan, who was a nurse practitioner in the South, followed by the same photographer. And just these beautiful images of her care of patients in the South. And just really, notice the hand on the shoulder. We talked about that a little bit. They're just great, great images. Both of these photographic essays were really important. I'm going to move on quickly because there's something I do want to end with, and that's this image. This is Michelangelo's Sistine Chapel. I can't imagine that you're not familiar with this image. This is one of the most famous images in all of art history. But I wanted to focus on this image of God, and I want you in particular to pay attention to the background of what's going on here. And what I'm going to do is I'm going to show you a sagittal cut of the brain, and you can see how this form is really the same form as what Michelangelo uses to show God. And this becomes such an interesting thing. Scholars have looked at this, and Michelangelo would have been doing dissections probably illegally at that time. He would have known what a sagittal section is if, I cut right through my head this way to the back. He would have known what a sagittal section was. And the fact that he puts God in a human brain is really, really a curious thing. Most of the popes, et cetera, at that time wouldn't have known about this and could have been seen as absolute blasphemy if you think about the idea that God is in man's brain. Now, some religious scholars would say, no, this is the moment where God is giving intelligence to Adam. He's passing on intelligence. He's passing the brain on. I don't know. It's kind of curious, but I think it's a really fun thing to think about. So thank you for all your attention. I really appreciate it. And we're going to stop there.
Yeah, well, thank you, Charlie. Lots of great images of medical science in various periods. It really helps us think about where we are today. Had some great comments in chat. Gail says, totally fascinating talk. Thank you, Charlie.
Oh, you're welcome.
Can you do another talk around this, like part 2, if you will? I bet you could.
I certainly could. I have hours and hours of images. Yeah.
And Lucretia says, this was a fascinating presentation. Thank you so much. Would love it as a series so we could go a little slower. So much, it was so rich in images, Charlie.
Yeah.
Claire also says, wonderful program, and it was nice to see you.
Yeah, thank you.
This is so fascinating, Rodney.
And there's Paco, yeah.
Yeah.
So,
Thank you, Charlie.
Oh, you're very
You
welcome.
were excellent.
Oh, thank you.
Thank you, Charlie.
Oh,
You're
yeah.
welcome.
Marcia also says, please do a number 2 and show more female doctors. That would be great to maybe see some more contemporary images.
Yeah, you have to remember that pre-19th century, there were some doctors in the 19th century. They weren't typically put in artworks, right? It really, that was an unusual thing. And so, you know, there were healers, of course, and midwives, but they're not typically shown in artworks.
Hey, Charlie, do you ever run across current artists, like contemporary, maybe people in the Bay Area who make images that reflect on medical science?
Bay Area, ooh. Nothing comes to mind immediately, but there are lots of contemporary artists that have also done. Now, it's not just medicine. Like I have a whole series on how diseases and artists that had diseases and how that affected. So, you know, that I can do the part 2 right there. You know, really good example is Van Gogh, you know, who used a lot of yellows in his paintings. And a lot of medical historians think that that's because he was, you know, he used foxglove to control his heart issues. And foxglove is the active ingredient in digitalis or digoxin. Some of you may be even beyond that right now. And if you get toxic with digitalis, two things happen to you. You see yellow and you see halos.
Hmm.
So knowing that,
Wow.
yeah, it's really interesting.
Wow.
Yeah. So
Well, Charlie, thank you so much. We will definitely have to have you back. In fact, we are going to have you back in June when we talk about the F-64 exhibition going on at SF MoMA. So it's always great having you. As you know, Charlie, I'm a big fan. I always enjoy talking to you about art. This has been Art Viewing Adventures. And I think at the top of the show, Jennifer talked about some other things that are coming up, including Art with Elders, which will be next. And then at 6 o'clock, it sounds like my good friend Richie Unterberger will be talking about the mamas and the papas.
I'm gonna be there with Rodney.
And Paco will be there. I'll be there too, Paco. So see you in a few hours. Thank you
Yeah.
very much, Charlie, and everyone.
oh, you're very welcome.
Stay
Thank you,
healthy.
Charlie.
Thank you, Charlie.
Stay healthy.
Love
Keep your
this
vaccines up
work
to date.
too. I got fascinated too.
All right. Goodbye.
Take care,
Good
everyone.
night. Oh, see you tonight, Rodney.
You.